Hi, I'm Julia. I'm a Public Health AmeriCorps intern, and I've been working with those exposed to and living with hepatitis C for about 10 months.
My name is Madison, and I work for Matthew 25. I am the Indiana Prevention and Education Specialist and Hepatitis C Care Coordinator.
My name's Morgan, and I'm a Prevention and Education Specialist with Matthew 25. One of the reasons I love being a care coordinator is I love being able to care for this vulnerable population of people that's often forgotten. I really love the heart of Matthew 25 and that they really try to make care accessible for people by removing those barriers that people don't usually think about. Hepat is liver and itis is inflammation. So hepatitis C is inflammation of the liver. It can affect your whole body because all your blood passes through your liver. So it's something that can be pretty chronic and that can affect all parts of your body.
Hepatitis C is a bloodborne disease that nowadays is usually, people usually contract it by IV drug use and sharing injection drug use equipment. It can be you can contract it in other ways, such as snorting drugs or even smoking drugs. But that is one way. Other people have gotten it in the past, like there's the baby boomer generation that we see high rates of hepatitis C in. From people being in the army, that they use the same syringe to give vaccines or other medications. It is blood to blood, so the mother can also transmit it to an unborn child if she's unaware she has hepatitis C. But those are the main ways. Some other uncommon examples are people sharing items that's with someone who has hep C. So if you share like razors or glucose monitors, that is also another form of transmission.
I think that hepatitis C is something that can have no symptoms. So it's important to get tested if you think you are at high risk for hepatitis C. I think that everyone should get tested at least once in their life just to know. But it can be something that lays dormant and you don't have any symptoms of. So it's definitely really important to get tested.
Since I've worked here, one of the things that people think hepatitis C is hepatitis B. And people also think that with previous treatment, it's very expensive and time-consuming, but it's not that now. And it's very easy to achieve, get treatment as long as you're wanting it. And then there's a lot of incentives, at least that at Matthew 25 we can offer to help offset costs and other different things that community organizations can help with to receive treatment, so that will help someone obtain it if they aren't able to normally.
I'm someone with lived experience, and so I heard a lot of these when I was back in the day. So the biggest one I heard that I always like to kind of debunk to people is that you could give Hep C to yourself. I really wanted to believe that because I didn't want to admit to what I did, but that is untrue. That's probably the most common one I hear people still saying, and it is bloodborne, so you do get it from another person's blood, so it's definitely false. And the other one would be that it's expensive to get it cured. So that's no longer the case. It may have been in the past. Actually, medication prices have fallen a lot. And there are programs that people can get their medications as low as $5 with a copay card. So those are probably the two biggest misconceptions I've heard.
I would say one is that it's not curable. Hepatitis C is definitely curable. It's a treatment that can be 8 to 12 weeks with a pill. So I think some things that people think is that it might be lifelong, kind of like HIV or something like that. Another myth is that people who have hepatitis are dirty, which is completely false, and it's very treatable. So.
Active Care program essentially is a grant that we received that has some of those incentives, and we receive funding to provide those. So it can range from obviously treatment, so we're able to prescribe medication, but when you're enrolled in our program, then you are able to receive a card for either food or gas, so transportation to and from your doctor's appointments, and not just our appointments, but other doctor's appointments. And then food, like going to the grocery store and getting whatever you're needing. There's also, we can enroll you in some like backup insurance, that will help cover anything that your current insurance might not be able to. And there's other little things that we can help with as care coordinators, just like any kind of issue that you might be having with re-enrollment with insurance, or just as your kind of like care coordinator or case manager, we can call on your behalf. So if you're having issues obtaining your medication, or something with your insurance in between your treatment times, like your weeks or your months obtaining that medication, we can call on your behalf and make sure that, or our patient's behalf, to make sure that they're receiving their treatment on a timely basis, and following up with them about any questions that they may have, education. We have other incentives too, like little cups and little pens that if you might need, and prevention supplies as well. So harm reduction kits, if one of our patients is using, or someone they know is using, they can do it safely.
Yeah, so thankfully, we are funded through the Connect to Cure grant, so we have a lot of great opportunities through that grant. The first being when it comes to transportation, we can give people up to $60 a month for medical transportation. We just need some limited information from them as long as they're enrolled in our program. And that $60 a month can actually also go towards nutrition. So say they want 30 towards medical transportation, 30 towards nutrition, we can do that on a reloadable debit card. And then the other way for other things such as housing, insurance, and other, referrals, mental health, we partner with a lot of places in the community where we are able to send those referrals. So it's really just working with other agencies in the community who already are doing this work and getting our clients connected to them.
So something that the program that we do, Connect to Cure, offers is like we have like a PEX card, which can help with gas and food. So that can kind of help remove some of those barriers of getting to an appointment. Another thing is just being as open as possible. I know that getting treatment for hepatitis C can seem really scary at first. So with all of my patients, I make sure to explain to them kind of what hepatitis C is, and that it's not as scary as they think. And I want to be there to hold their hand and kind of walk them through treatment. So if they have any questions, any fears, I want to be the person that they can come to kind of ease those fears.
Harm reduction can look like many things. It can look like Narcan, it can look like safer using equipment, anything that can help prevent the spread of hepatitis C or HIV.
If they could have just harped on harm reduction, I definitely felt stigmatized as a drug user when I came in. I was very honest about that when I went in for treatment. And if they could have just given me some harm reduction, practices, I was pretty aware of them, but not of the resources in my community. There weren't many. This happened to me in rural Appalachia. But if they could have just given me something, just so I felt supported and I just didn't feel like I was coming in, talking to the doctor for 5 minutes and getting my blood drawn. I really think it would have made a difference if there was like a care coordination program, and there was someone that I could talk to as a peer, and that had, my best interest in mind. So I really felt supported. I felt really disappointed in myself, which there's no reason to feel that way now that I've been through treatment and I work in this field. But it was a different time. This was 2015, 2016. So I feel like the harm reduction movement wasn't really strong. There wasn't really drug users' rights, that kind of movement that's been going on. So I felt really stigmatized. I felt really alone. I didn't know anyone else in my college or my university that was doing the same thing I was. So I felt like I had no one. I didn't have any mental health resources. My family was 3 hours away. So that was probably the biggest thing. I was pretty scared, especially because I didn't have the education I have today. And I think the hardest thing, just because I felt so alone, was telling my parents. They already knew my addiction struggles, but just to go on and let them know one more thing was really, really hard for me to do. So that was probably the most difficult thing. I didn't really struggle going to the doctor. I wanted to get this taken care of, as do most people with hepatitis C. We want to get treated, we want to get well. But it's just kind of that stigmatization that, really internalizes when you hear something like that, and you feel like you're just another number, when in reality we're real people who have real stories.
So the most important thing to remember is that we're here for you, and that it's very treatable and that you can live a long, happy life with it.
Just understanding that it is curable and that it might take a little bit of time. So just patience and trusting us as care coordinators that we're going to help find them the best possible avenue for treatment. And I know that's a lot to say because I have trouble trusting and working with people myself, like whether it be in my job or my other friendships and stuff like that. But trusting us that we're going to try to do whatever they think is best for themselves and help them to find that best avenue, I think is the best portion. And even it's going the lengths of like just educating them on it. So letting them know like this is what your liver is and how it affects them, and that if you don't get treatment, this is what it might look like, and showing diagrams and stuff like that. But just take a deep breath. Essentially trust the process and like just try to be patient because we're here to help you and ultimately help you get better and not let hepatitis C rule your world. So
Yeah, I just say stick with it. Thankfully, treatments nowadays are either 8 to 12 weeks, so 2 to 3 months. I think my treatment was almost, 8 months. So things have really improved. So just stick with it. Talk to your provider if you have any questions. They should be able to answer them, even if they're not as open with you at first. They still are there to answer your questions. And like anything from like a missed dose to side effects, like let them know because that is their job and they're there to help you. And the other thing is reach out to local groups in your community that might be focusing in harm reduction. Just whether you're on the path to sobriety or not, getting involved with that can be really beneficial, especially if you are still using. Those can provide you with whether it be safer using kits or if you're in a place with SSPs, they have all the things to keep you safe. And definitely become an advocate if you're comfortable with that. Speak up if you feel comfortable about your lived experience, and just let the world know that we are people and this is a very common disease that can be cured in as little as 2 to 3 months. And make sure to use that word cured because you can't get cured.